So when you look or when you examine the abdomen of the individual, as we've already gone through the fact, we basically perform this examination in a particular way. And the idea behind performing this examination in this particular pattern, this particular systematic pattern, is to basically narrow down the differentials for these patients. The herniation is one of the cause. It can be it can be a pelvic herniation. It can be an umbilical herniation. It can be even an inguinal herniation, which is again related to the abdominal pain that is occurring for this particular patient. So you look for this herniation factor over here. Then the rectus sheath hematoma is very important. It can be one of the etiological causes. So it is basically a benign tumor which is present in the rectus sheath that is present basically just anteriorly. It makes the anterior abdominal wall. So if there is any kind of an hematoma that is present out there, it can relate to the abdominal pain. Herpes zoster, it usually can occur in any of the particular cutaneous regions. It can involve the thoracic region. It can even involve the abdominal region. So it can be one of the causes, which is also commonly known as shingles. Then we have patients of endometriosis. That is basically the presence of the endometrium in an ectopic area. So that is again even one of the important causes of the abdominal pain. Neuromas are one of the important causes. We have the desmoid tumors, which can relate to it. And then we have the myofascial tears, which are again basically the fasciculus that is basically surrounding any of the muscle fibers. It can tear and it can relate to the abdominal pain as well. The intra-abdominal adhesions, why do they occur? They usually occur due to the repeated surgical procedures. When you open up the abdomen and when you close it down, it leads to the development of these adhesions. And the number of surgeries that are performed on the patient, it can basically relate to the number of adhesions that are present out there. Now the treatment, how do you basically design a treatment for the abdominal pain and all of these miscellaneous causes? You first find out the triggering point, you move down towards narrowing down the diagnosis, and then treat accordingly. Whatever the cause is, you have to basically alleviate that cause. One of the major factors over here is the patient education. So you usually educate the patient, or if it's the caretaker, you can even educate that caretaker or the mother or a close relative as well. Lidocaine injection is very important in alleviating the symptoms of the abdominal pain.